this is Dr. Wells with Wells Medicine, and I wanted to talk today about psilocybin, which isn't currently legal in the state of Texas, but is in front of the Texas Senate and the Texas House right now, with the possibility of decriminalization, but that hasn't passed yet as of this taping. Psilocybin is a natural compound that comes from mushrooms, but I will remind people that there are lots of natural compounds that come from mushrooms that are completely poisonous and toxic. So please don't try this at home, and be super careful with natural mushrooms, even though they are natural. There is sort of a health halo around things that are natural. So a lot of people have great interest in psilocybin, and it's so easy to read the anecdotal reports of people having magical mushroom experiences and then being cured of their mental health conditions, and think that this is sort of a one-stop shop, and one dose and patients are fixed forever. I don't have patients that have been treated with psilocybin through medical means in Texas, because again, it's not legal in Texas. But I do have patients who have recreationally used psilocybin and patients who have sought medical treatment with psilocybin in states where it is legal, or decriminalized rather, which I can get into the fine points of the difference between legal and decriminalized. But those patients who have had psilocybin, whether recreationally or through medical treatment, it seems to be about 1 and 6 months. So not one and done, but one giant 6-hour long, sometimes very nauseous, revelatory, incredibly intense, sometimes disturbingly intense, fraught experience that they process over the course of several weeks. And then they seem to, when it works, feel better for about 6 months. So one of the unfortunate things is we don't have a lot of the anecdotal data from patients who have side effects from psilocybin, or who don't experience that epiphany experience, or for whom it just seems to be a interesting 6 hours, and then they don't receive any benefit from. It's hard to study psilocybin because, again, it's not legal in a lot of the states, and so it's difficult to work with substances that aren't FDA approved and legal. Psilocybin is decriminalized in several states in America right now, in several cities, and there are several countries that have decriminalized psilocybin. So what decriminalized means is that police officers and judges will not make it a priority to charge people and to arrest them for possession of psilocybin. But that's very different than having something actually be a legal FDA-approved medication, where everything is kind of above board. There's testing, there's a lot of oversight, accountability, that just allows things to be studied in a much more efficient and thorough way that psilocybin really hasn't been able to be studied yet. Similar to the way that we didn't have great data on marijuana before it was legalized in several states, and now we're just beginning to see, a decade's worth of data on the benefits and the drawbacks of marijuana. When patients ask me about psilocybin, the first thing I have to say is it's still not legal in the state of Texas, so I can't recommend it. But also that a lot of the popular press emphasizing, a one and done approach, I just don't see that in my practice. Generally, it seems to be 1 in 6 months, and it seems to be a very intense, rather laborious process of the 6-hour trip. And some people find it to be a very uncomfortable process and don't receive the incredible benefits that the prophets of the psilocybin movement and adherents to that movement seem to swear that everyone will receive upon taking one dose. I like to laugh that, psilocybin at one point was legal, and the generation back in the 70s and the late 60s, when it was first kind of coming into the American psyche, they used psilocybin much more liberally than we do now. And those people weren't all, free from depression, free from anxiety, living their best life then. Similarly, it has to be done within a therapeutic context. Recreational doesn't have the structure and the scaffolding that you need to integrate those changes into your life. And then it doesn't always work. There's a significant percentage of people who have side effects, like continued hallucinations and perceptual difficulties. Some people even have lasting, fraught memories and side effects from the experience itself. I've treated patients who thought they had PTSD from their psilocybin journey. Really, I can't recommend enough, if you are going to do this, do it someplace where it's legal, there's accountability, there's oversight, in a therapeutic context. And again, anticipate that even if you do receive benefits, it's going to be about 1 in 6 months, not one and done.